your spouse, or a best friend, or maybe it's you. Maybe you know what it feels like to sit beside someone you love and not know how to help them. Mental illness does not discriminate. It touches every community, every income level, every family in Rhode Island. And yet for too long, people have suffered in silence because they're afraid to share what's going on. That's why gatherings like this matter. What brings us together today is beyond policy and legislation and state budget items. Today is about people. It's about lives saved. It's about the courage to share one's story. And it's about our shared responsibility to build a Rhode Island where no one faces a crisis alone. Good afternoon, everyone. On behalf of the Mental Health Association of Rhode Island, welcome to the 2026 Mental Health Awareness Month event. My name is Marie. For those of you who don't know me, I'm the Executive Director of MHARI. Today we're honored to be joined by members of the Rhode Island General Assembly, one member of our congressional delegation, leaders from state agencies, advocates, mental health professionals, community partners, and people with lived experience, all working together to build a stronger behavioral healthcare system for all Rhode Islanders. I especially want to thank all the leaders who are here today. Your presence sends a message. It says that mental health matters. People living with mental illness and addiction matter. And it tells us that Rhode Island as a state is committed to ensuring that every Rhode Islander who needs care or services has a right to those care and services. This year is especially meaningful to MHARI because we're celebrating our 110th anniversary. Thank you. 110 years, it is extraordinary. For more than a century, MHARI has advocated for dignity, justice, and access to care for Rhode Islanders living with mental illness and substance use disorders. Our roots trace back to the mental hygiene movement inspired by Clifford Beers, who lived with serious mental illness at a time when people were hidden away, dehumanized, and forgotten. Mr. Beers spent much of his adult life living in what used to be called asylums. They were filthy, they were overcrowded, people could be caged, literally. People could be restrained and shackled in place with iron shackles. It was a really dark time in our history. But instead of remaining silent, he decided to speak up and share his story. He wrote an autobiography called A Mind That Found Itself, and it was read by physicians across the country. And together, they sparked a national mental health care reform movement across the country. His advocacy helped launch the use of outpatient behavioral health services and early intervention services. It prohibited the use of restraints like shackles and cages and gave standards to mental health institutions. In 1909, Mr. Beers founded the National Committee for Mental Hygiene, which is now called Mental Health America, our parent organization. He later opened the nation's first outpatient mental health clinic in Connecticut. His advocacy helped pave the way for the National Mental Health Act and the creation of the National Institute of Mental Health. In 1953, he called on psychiatric institutions across the country to send him their iron shackles. And he took those shackles and he melted them down, and he made a 300-pound mental health bell, which is in our logo. That bell represents hope, dignity, and the progress we've made. It also reminds us of how far we still have to go. The Mental Health Association of Rhode Island, our affiliate, was founded in 1916. We remain deeply rooted in lived experience. We believe some of the most powerful advocacy comes from the people who have walked through the pain, survived it, and chosen to speak out others know that they're not alone. When people with lived experience share their stories, they change hearts, they change policies, they change systems, and they help drive change toward a more robust, compassionate, responsive behavioral health care system. When leaders and communities work together, extraordinary progress can be made. And over the past few years, Rhode Island has made quite extraordinary progress. We've added 46 new residential treatment beds for adults and youth. We've opened the nation's first state-sanctioned overdose prevention center. We've secured a $156 million federal rural health grant. We've reduced waitlists for youth behavioral health services. We've continued funding for certified community behavioral health clinics. We established a short stay unit at Butler Hospital so people in crisis don't have to wait in an emergency department. They can get immediate care. We've established a 988 suicide prevention and crisis call center with the highest in-state call answer rate in the country, and with literally a rate of picking up the phone within 1.9 seconds. That's phenomenal. Our leaders have made historic investments in our behavioral health care system. We funded Eleanor Slater Hospital and renovations and specialized group homes for people who live with disabilities. And we've continued to staff and fund the implementation of Rhode Island's first homestead plan for Rhode Islanders who live with disabilities. I want to express our deep gratitude to Governor McKee, Lieutenant Governor Matos, former Speaker Shikarchi, Senate President Lawson, and our House and Senate leadership, all members of the General Assembly, and of course our intrepid federal delegation. Your advocacy and investment in our communities and in our system make a difference in Rhode Islanders' lives every day. Let's give our leaders a round of applause. I'd also like to acknowledge our partners at the Department of Behavioral Health, Developmental Disabilities, and Hospitals. Thank you for your dedication, your vision, your leadership, in building a compassionate and coordinated system of care in Rhode Island. Let's give them a round of applause. We have not seen this kind of investment in our system and attention on behavioral health care in decades. We are deeply grateful for all this progress, but we know that the work is far from over. Waitlists for some services still exist, and any waitlist is one too many. No one should have to wait for services. Imagine reaching out for help and feeling low and vulnerable, only to be told that you have to wait weeks or months for the service that you need. It's demoralizing and it's dangerous. Other patients are stuck in the hospitals because there's no lower level of care appropriate for their needs. So they're taking a hospital bed that they don't necessarily need clinically. Rhode Island continues to face a severe shortage of adolescent prescribers. We also have forensic patients remaining in prison instead of getting treatment in Eleanor Slater Hospital. And while overdose deaths are decreasing, non-fatal overdoses are on the rise in Rhode Island. We also expect federal Medicaid cuts, which threaten healthcare access for Rhode Islanders, some of our most vulnerable neighbors. And in the years ahead, Rhode Island may have to face difficult fiscal decisions and budget deficits. But we must decide together that behavioral health care remains a priority, because these investments save lives. This year, MHARI and our community partners are advocating for a number of initiatives and funding investments that we'd like to share with you today. We support and hope the General Assembly will pass a piece of legislation that would print 988 on student IDs. We would like to expand mental health education for all 7th graders in our state. We believe there should be continuing investments in certified community behavioral health clinics. They're a very important part of our continuum of care. We would like to reduce unnecessary prior authorization barriers for in-network behavioral health care services so that Rhode Islanders can access services without any delay or limitations when needed. We want to see a strengthening of Rhode Island's behavioral health care workforce by ensuring providers are compensated fairly for their expertise and their time and their services. And we want to see more oversight on the use of solitary confinement in prisons because we know that people with mental illness are disproportionately put into solitary confinement. We'd also like to see artificial intelligence and the use of healthcare to have more oversight and transparency. And we'd like to establish a permanent funding source for the 988 Suicide Prevention and Crisis Line. This work is deeply personal to me. I know what it feels like to be trapped in darkness, alone, and to believe that there's no way out. But I also know the life-saving impact that compassionate services and connection can have in changing a person's trajectory. In 2016, during one of the most difficult periods of my life, I called the crisis helpline because I was desperate for support. The phone rang and rang. I had to call back a few times before I actually got someone on the phone, and when she answered, there was no counseling, there was no listening, there was no support. She simply said, if you feel unsafe, you should present yourself to the emergency department. That experience stayed with me. And it's one of the reasons why this work and the work that we're doing around 988 is so important. 988 is not just a phone number. It's hope in the middle of a crisis. It's a lifeline, and sometimes it's the difference between a tragedy and a recovery. And that's why we're calling on our leaders to pass House Bill 8177, sponsored by Chairwoman Shawcross Smith, and Senate Bill 3058, sponsored by Chairwoman Melissa Murray. These two bills are both necessary to sustain our 988 call system. These two bills make it whole. Without a dedicated funding source for 988, it will always be vulnerable. We'll always have to scramble to find funding for it. And if we lose our call center, or we lose the capacity to answer every single call that comes in, Rhode Islanders will be routed to call centers in other states. Behavioral health care saves lives. Behavioral health care saved my life twice. When I was 17, I was diagnosed with anorexia nervosa. I lost a dangerous amount of weight, and I was disappearing a little more each day. I was very lucky because my mother's health insurance plan covered residential treatment, partial hospitalization, and long-term outpatient therapy. And I made a complete recovery because I had all the care that I needed when I needed it. Years later, in my 30s, I became severely clinically depressed. I mean, I've lived with low-grade depression for much of my life, but this was something off the charts that I had never experienced before. The episode lasted 2 solid years. I cried myself to sleep every night. I would run to the bathroom at work to cry in the bathroom stall. I cried on the subway in Boston. It's hard to explain to someone who's never experienced that what that kind of emotional pain feels like. I could not think myself out of my depression. I could not write myself out of my depression. It wasn't a matter of positive thinking or more exercise. My brain chemistry was simply awry. I attempted suicide on my 40th birthday, but I survived because there was a psychiatric bed available when I needed it, for as long as I needed it. Right now, our country is going through some very difficult and uncertain times. People are scared, people are overwhelmed, many of us feel emotionally exhausted. We know that there may be fiscal challenges ahead, but moments like these reveal who we are. When budgets tighten, it becomes even more important to distinguish between expenses and investments. Behavioral health care is not optional. It's an investment in human lives, healthy communities, public safety, and long-term stability. When people cannot access mental consequences do not disappear. They surface elsewhere. We see them in overcrowded emergency departments, the overutilization of hospitals. We see rising homelessness and rising rates of contact with the criminal legal system and incarceration. We see lost productivity at work. We see family trauma, and we see lives tragically cut short. Mental illness does not pause during economic uncertainty. Addiction does not wait for better budget forecasts. And people in crisis cannot simply be told to hold on until conditions improve. So as Rhode Island navigates the challenges ahead, I urge our leaders to continue prioritizing behavioral health and Medicaid. We cannot abandon vulnerable Rhode Islanders at the very moment they need us the most. Behavioral health care saves lives. And the true measure of a community is how we care for one another, especially during those difficult times. Today, we will present awards to 3 leaders in Rhode Island who've shown up time and time again for Rhode Island's mental health community. Their public service has created lasting change. But first, our first speaker received Mental Health Association's Lion Heart Award for Fearless Mental Health Advocacy in 2025. We are honored today to welcome again Barbara Morse of NBC 10 News. Barbara has used her platform to shine a light on mental health, substance use, recovery, and the human stories behind these issues with compassion, integrity, and care. Responsible journalism has the power to reduce stigma and educate the public and even inspire change. And Barbara's work has helped do this, bringing greater awareness and understanding to behavioral health challenges facing Rhode Islanders. Please join me in thanking and welcoming Barbara Morse.
You've lived it. I've lived it in the family. My mother was bipolar. It ended up taking her life. Advocate. I have a daughter who just January called me rock bottom, unhinged, from Denver, and said, Mom, I don't know what I'm going to do. I flew her home. And I don't know if any of you are with the Rhode Island Partial Hospital Program, but I praise you because y'all saved her life. She came back, was here for 3 weeks, is back in Denver doing well. It's a struggle. I mean, things going on in this world are fueling mental illness, in my humble opinion, and not feeding mental health. When things get tough, it really gets tough for those who are impacted. I've seen it firsthand. It hurts. It hurts to the core. And this is why we need legislation. You talked about somebody answering in 1.9 seconds. Last time I was here, my daughter called the suicide prevention hotline when she was in college. It was put on hold. On hold. She called me, she goes, they're not getting back to me. I said, you're flying home. Not everyone can do that for their loved one. And that is the sad truth. And that's why we need legislation. That's why we need more people in the workforce. We talk about health care. Well, we don't take our health care insurance. We don't take health care insurance. It's gotten so tough to get help. It's gotten better. I'm not going to lie. It has gotten better. But it is tough. And we need our lawmakers, thank you, to be out there advocating for better laws, more people incentivizing, getting more people into this field because it is a lifesaver. We are losing precious lives every day. I can fill up this room with people I know personally who have died as a result of addiction and mental illness. It is sad. And I want us to be glad. I want us to be able to be jubilant about the things we do to change the tide. We need to. How many of you agree? How many of you have been touched? There better be every hand up in this room. Because if it didn't touch you personally, someone you know, it could be someone you work with, it could be a loved one. who is struggling. And we need to help each and every one. Even the people who are out in the street who are begging for money, they all have stories. They all have stories. We walk by them like they have a disease. Yeah, mental illness, which is treatable. We need to treat people with respect. So I'm very excited to be here. I know I feel like I'm channeling my grandfather, Reverend George Washington Worth, on the pulpit. You go, praise Jesus. We're going to work this out, and we're going to make it work, and we are going to make it work. Amen. With the help of all of you, each one reach one, talk to your congressman. There might be one in the room. Choose your own. And let's make a difference, everybody. I'm so happy to be here. Get out there, boots on the ground, do what you need to do. But I thank you all for being here and for being lifesavers or willing to save one.
Wow. Thank you so much, Barbara. That was incredible. Thank you so much for sharing your story. Our next speaker is Congressman Gabe Amo, who proudly represents Rhode Island's 1st Congressional District. Throughout his public service, Congressman Amo has demonstrated a deep commitment to improving the lives of Rhode Islanders and advancing policies that improve Rhode Islanders' lives, promote health and equity and opportunity for all. He's been a strong advocate for the mental health community and is a great proponent of community well-being as well. We're grateful for his partnership and his leadership in DC and doing such important work there on behalf of Rhode Islanders. Thank you so much, and please help me welcome Congressman Amo.
Thank you so much for that kind introduction. Barbara, it's always an honor to be on a program with you. I'm going to get a little bit of church, I'm going to get some inspiration, I'm going to get a lot of things, and that's important for all of us. But thank you for your leadership, from watching you on TV to seeing you in the community. You are committed to this place in a multitude of ways, so thank you. And Lori, Marie, thank you for your courage, your strength. It's not easy to get up here and share your darkest moments, your most difficult moments. Why it's essential is because you are proof of a few things. One, you've got tremendous resilience. And two, that systems, when they are funded, when they are supported, when they are enriched by the hearts and passions of people like you, can work. So I'm grateful for you. I'm grateful for MHARI, for your leadership. Every time I've called, the short 2.5 years that I've been in Congress, you have helped me learn more, advocate, use my voice, fight the uphill battle. And we know it's uphill in Washington, but fight it informed by perspectives of Rhode Islanders that we all care for. And so thank you for that. Because this month, this May, as you all know, is a time to redouble our efforts to reduce the stigma and recommit to the facts. I'm preaching to the choir here. Mental health care is health care. You all know that, but it's something we have to commit to saying over and over and over again, right? Because Rhode Islanders deserve care they can actually access. More than 200,000 Rhode Islanders live with a mental health condition. Nearly half of adults who needed care last year did not receive treatment. We all know that's unacceptable. And too many families are spending weeks, crucial minutes, hours, fighting insurance, struggling to find providers. That's unacceptable. And that's why I'm grateful to be here. I was going to sit in the crowd because we have some changes that are now done secondary. I'm going to fight in Washington, but this is important that the great legislators that we have in this state of Rhode Island, starting with our speaker, our former speaker, but he still gets the title. That's how it works. Joe Shikarchi, who puts his money where his mouth is. And you know, this job, the job that he once had, is one where you have a lot of people coming down on the door, and you have to make the math work. But when you lead with heart, you find a way to make it work. And Senator Ojafusa, in that great chamber, your leadership is so deserving of recognition today. Every time I see you, you would tell me, Gabe, this is on the should be doing, and doing more of. And I'm grateful to you and CARE. Thank you for your lifelong advocacy that you're doing. Every time I've seen you, I've been grateful for the opportunity to hear your voice. So I'm going to be short here. We just need to invest. We have to invest. I work in a place right now that's having a tough time doing some things. But I take the stories of Rhode Islanders with me every day because when we invest, lives are saved. Mental health care, as you know, should not depend on your zip code or income, whether an insurance company decides to approve treatment. So we're going to do everything we can at the federal level. I'm not here alone. You have the spirit of Jack Reed, Sheldon White, and Seth Magazine, and my dedicated partners in this work. We will continue to fight and advocate for the resources to fully fund 988, expand school-based mental health services, protect Medicaid. The bottom line is, in a moment where so many people are hurting, the answer will not be, cannot be fewer counselors, fewer crisis workers, fewer places to turn for help. Marie, you talked about hope, dignity, and the progress left to go. Hope, dignity, and the progress left to go. So we know our mission. All is clear. I want to thank these great advocates, leaders, elected officials for their leadership. We're united in this battle, and we will win. So we just have to keep pushing until we get there. Thank you.
It's now my pleasure to introduce Rhode, the Director of the Department of Behavioral Health, Developmental Disabilities and Hospitals. Director LeClaire has dedicated his career to strengthening the services and supports for Rhode Islanders living with mental illness and substance use disorders. Under his leadership, Rhode Island continues working to expand access to care and to strengthen the continuum of services. He's advanced critical initiatives that support some of the state's most vulnerable Rhode Islanders. We are grateful for his partnership and his commitment to improving behavioral health care across Rhode Island. Please join me in welcoming Director LeClaire.
Good afternoon, everyone. Thank you, Marie, and the Board of Directors of the Mental Health Association of Rhode Island. Thank you for the work you do every single day and the difference you make in the lives of Rhode Islanders, strengthening our communities. I'm honored to be surrounded by such dedicated advocates in behavioral health care. Speaker Shikarchi will go with this. Okay, thank you. Senator Fusa and Karen Jeffries. Speaker Shikarchi has a long, acknowledged history of supporting behavioral health care services for all Rhode Islanders. Over a decade ago, he was leading the charge in mental health first aid and mental health crisis training for law enforcement and all first responders in Rhode Island. This was recognized at the national level. And in 2017, then Majority Leader Shikarchi was recognized as Legislator of the Year by the National Council for Community Mental Wellbeing at their annual conference in Seattle, and was presented with that prestigious national award in front of 5,000 members. In 2022, under his leadership, the CCDHC service delivery model was implemented in Rhode Island, bringing access and evidence-based behavioral health care services to all Rhode Islanders. Senator Ijifusa is known and recognized for her history of advocating for mental health and substance use treatment parity, for reducing barriers to access to treatment, and for improving healthcare affordability for all. Karen Jeffries is a longtime supporter and promoter of behavioral health care services and is everyone's favorite behavioral health advocate, even in retirement. We owe each of these awardees a debt of gratitude for their work and for their accomplishments. During Mental Health Awareness Month, the it is especially meaningful to recognize the incredible work being done by everyone in this room. Mental health affects every family, every workplace, every school, and every community. This month reminds us that supporting mental health is not only responding in moments of crisis, but also about creating systems of care that build hope, connection, and well-being every single day. Thank you for helping to strengthen the partnerships with healthcare providers, our invaluable community organizations, and state government. So much of the progress we've made has been built upon those collaborations and those organizations. We're fortunate to have more tools than ever before. Through our National Suicide and Crisis Hotline 988, as mentioned before, we continue to break down barriers and connect people to compassionate, timely, and support. From the very beginning, our vision was to make 988 the front door for behavioral health care, not simply the last resort, but the first step in an early path to care and connection. We have expanded access to our certified community behavioral health clinics, or CCBHCs, as I mentioned before, which provide critical services, including crisis care, medication management, primary care screening, care coordination, and many others. These efforts are helping individuals receive support early, creating a more connected and responsive behavioral health care system. In Rhode Island, we also have steadily implemented and expanded recovery support services where recovery housing, recovery centers, peer recovery is available to assist all Rhode Island in search of home, health, purpose, and community. During Mental Health Awareness Month, we recognize that progress is measured not only by programs and systems, but by people. Every individual who reaches out for help finds support, every family that finds hope, and every community grows stronger when we stand beside one another. So thank you for your partnership, your advocacy, and your commitment to this work. Together, we are building a stronger and more compassionate Rhode Island, where every person has the opportunity to access care, find support, and thrive. Thank you.
Hi, everybody. My name is Nancy. So, like I ran into and I received help for 20 years. Having used drugs early, hoping that one will alleviate the emotional and mental pain that I was going through. I have quite a few diagnoses, and it's kind of hard to live with that. Not because I don't worry about what anybody thinks about me anymore as far as that is concerned, but living with it, that's what's hard. When you have all these things going on in your head, you do not know what to do. It's awful. You see people that manage situations like what we call normal. And here we are, we gotta take a ton of pills, see a bunch of therapists, and do all this stuff just so we can be functional. Now, mental health support was created to improve the lives of people. Unfortunately, we don't have enough of it. I don't think it's enough. We don't have enough of it right now. We don't. There's too much separation, and I think everybody needs to work together to make this happen. I know substance abuse is the issue. I'm a survivor of that. But mental health concerns are not being addressed properly. And I think they should be. Because a lot of people dying out there because of this. I don't know what it would take for anybody to take serious that mental health is a problem. Nobody chooses to have a mental illness. No. I didn't decide that I was going to go a drug addict when I got older. That was not my dream. And I'm not looking at whoever looks down on me wish 988 existed back then when I was trying to kill myself so many times. I probably would have died here that sooner, but I didn't. Stigma kills. I see it in the hospitals. I see it everywhere. People, professionals, they should know what they're doing and they don't. I remember one of my attempts, I went to the hospital, and the nurses treated me like crap, like trash. I couldn't talk, I couldn't say no. I couldn't complain. And they had a security guard watching me 24/7 after being pumped and everything. No one came to talk to me. No one. Not a therapist, not a social worker, no one. Okay? We need more of this, not only in mental health institutions, but in other areas too. I think doctors need to be educated on mental health. Because when we go to these doctors, they don't know what the hell to do with this. And they do not know how to address it either. They don't. Their job is to cure the body, help with the mind. You know what I mean? But I think that we need to pay attention to the bigger picture, okay? People ignore the little things. You know, like the sand, the crazy sand, how tiny they are, but yet they fill the ocean. That's a problem with them. They're small, insignificant, or so they think, until it becomes a crisis. Okay? There's no need for anybody to have to go. No. There's not enough therapists here in this area, okay? Why? Pay has something to do with it. But also because it's an investment that people don't want to put it in education for a job that might not feel rewarded to them or whatever. Right? This is not just a job of human services in therapy. It's not to get rich. I got into this because I want to help because I want help. And also because there was a lot of people that did not get help. And at least I want to try to be the first one to tell them, you know you're all right, you're going to be okay. Well, see, I'm not a comic coach. I'm the first line of defense. They come to us first. Okay? We're the ones that went through it and have to talk to these individuals and help them get through themselves. We hope to be the example. But what happens? They get shortchanged. What good is a peer therapist, peer support specialist, if that person cannot go see a therapist? They have to wait a long time just to get somebody to see them. I know it took me a year, 1 year, after I got the detox to find a practitioner. And even now, it was difficult for me to find a practitioner. Okay? Even now. I had to get over from out of state because there were none in Rhode Island that understood me. Because they're Latino. So there's a lot of providers that I'm not culturally sensitive. Okay? We don't all learn and feel the same. But pain is shared. Pain is shared. And I just want to leave you with this. I have a friend who always said, you know, nothing beats a failure but a try. If we're not trying, we're absolutely fail. Thank you.
Hello everyone, good afternoon, buenas tardes. My name is Sandra Victorino. I am the chair of the MHARI's board of directors. And today I have the great honor and pleasure to be able to award the Legislator of the Year award to a leader who has vision, compassion, and steady leadership, have profoundly shaped the future of Rhode Island. Former Speaker of the House, Joseph Chaparchi. I'm going to move through some of this quickly because Director Leclerc has been so gracious to give us some of this information already. And proudly represents District 23 in Warwick. He became the Speaker of the House in 2021, and throughout his tenure in public service, he has demonstrated an extraordinary commitment to improving the lives of Rhode Islanders and strengthening our communities. Also during his tenure, he secured historic Medicaid rate increases for behavioral health providers and community-based human services organizations, helping agencies recruit and retain staff, stabilize services, and reduce wait lists The speaker has also supported the creation and expansion of certified community behavioral health clinics. Thank you. As a therapist, I know what that means, and I know the services that our Rhode Islanders are getting because of those services. He has championed investments in Rhode Island's behavioral health crisis response infrastructure to help ensure that Rhode Islanders experiencing mental health crisis could access immediate life-saving support. Advance community-based behavioral health care and homestead-related reforms by supporting major investments in home and community-based services for individuals with disabilities and behavioral health needs. Our children behavioral health initiatives, youth crisis services, and investments aimed at improving access to care for children and families. Over the past year, Rhode Island has seen encouraging progress in reducing the wait list, as Lori Marie has stated. And we are extremely grateful. I got a call last week, and someone was needing services, and I was able to navigate them because they knew me as a therapist, and that they didn't know the other numbers, and so we made sure that the family knew the other numbers, but that's how much the information is not out there yet, and it's about knowing someone, and it should not be about knowing someone. So I thank you for the access that you continue to push forward for those that are not able to have a person to call. What distinguishes Speaker Shikarchi, however, is not only the breadth of his accomplishments, but also the way he leads. He is widely respected for his thoughtful, pragmatic, and collaborative approach. Someone who listens carefully, values relationships, and brings people together to solve problems. His leadership has helped to make Rhode Island a more compassionate, equitable, and hopeful place to live. Please join me in congratulating former Speaker of the House, Joseph Shikarchi, the MHARI's Legislator of the Year.
Thank you. Wow. An introduction like that almost makes you want to stay. So thank you all very much. It is an honor and a privilege and a pleasure to be here. And I've been in this room many times in my career for different awards and recognitions and ceremonies. But this means a lot because, to be quite honest with you, it's a sense of accomplishment and pride of what we have done together. And I humbly, graciously accept this award, not just for myself, but for all of my colleagues in the General Assembly, especially my colleagues in the House. And I want to recognize them in one moment. But we need to work together to get things done. And that's been a slogan of mine, working together to get good things done. And that starts with my colleagues, Representative Casimiro, Representative Potter, Deputy Whip Ackerman, Representative Boyden, Chairman Bennett, and Representative Sanchez. We're all here, and as you know, this time of year is very busy. They're all in and out, going to different events. I appreciate it. Excuse me, I appreciate it very much because I can feel this with the passion, the pride that all of you have in the work that you do. So committed to help other people, and that's what government's all about. And in the last 6 years, people say, "Oh, you know, you have increased the budget, you've increased the spending," and I said, "Yes, we did, because there was a great need." And if that's a criticism, I'll gladly take it. I'll gladly accept it. I did increase the budget. We did because we had the money. We had a lot of COVID money. We had a lot of infrastructure money. We had money that the federal government was giving, and I was willing to take it and reallocate it and spend it on Rhode Islanders who needed it. Whether it was housing, mental health issues, a whole host of things, biosciences, that we have a brand new opportunity here to create some really good, high-paying private sector jobs, but also help our business climate. Eliminate taxes on the car tax and small business. 75% of small business do not pay tangible taxes in Rhode Island anymore. And that can go on. We help some of our largest employers, Citizens Bank, FM Local, etc. Because we're all in this together. And we cannot do it alone. Senator P.G. Fuso, and I say that correctly, it took me 4 years to run that. She was in the General Assembly for 4 years, and as I'm leaving, getting ready to leave in the next couple of weeks, Linda, you've been a great partner, a great ally, and I'm proud and humbled to share this recognition with you. You're well deserving, and I want to give you a round of applause. Senators here, and I will leave it to Senator Uji Fusa to recognize them. And I want to call out, of course, my good friend, Director Rich LeClaire as well. He's been an outstanding partner, and he talks about mental aid, mental health first aid. I was a freshman, and he brought me this idea. I immediately got all kinds of pushback from the police chiefs and police departments in general. Oh, you gotta make us do these things and training and this and that. And I used to lobby many years ago for the police. I had a lot of relationships, they were all mad. But in reality, when I started to talk to the police unions and the rank and file members, they embraced this idea of training, very simple training, very inexpensive training, to help de-escalate a crisis. Because when someone is having a mental health crisis, they call the police. And there's not a policeman in this state or a policeman I know who wants to unnecessarily use force for someone who is not dangerous, but is having a crisis, a moment. And it was with that training that police could learn about that and prevent tragedies and help that person get the right treatment and de-escalate a crisis. It was novel, it was new, it was difficult, but we did it. And when I received that recognition in Seattle for 5,000 people, I shared that with you then, and I'll share that with you now. You are a pioneer in this, and I know there's many people here, other advocates in the room who've done this as well, but it's working together, not giving up. And I know everybody in this room knows what that means, not giving up. It's not easy. It's not easy when you're allocating precious tax dollars, on a local level or not. And I want to recognize my good friend, the great congressman, who goes to Washington in an environment where they don't want to get things done, and spends every waking moment helping Rhode Islanders as best as he can, showing up, fighting, arguing, articulating, lobbying, pressing the cause to help Rhode Islanders. And that is a great congressman, and that's my friend Gabe Arnold. Thank you so much. I have a whole list of things that we can talk about, with great achievements. Most have been said. I don't want to belabor the program today because I know time is short. But I want to talk about two areas that we work collaboratively. One last year, which is to help the 340B program continue to strengthen our healthcare infrastructure system to the frontliners who provide benefits to everybody. And then this year, every year at the beginning of the session, we have these press interviews and people say to you, what do you expect the big issues? I always answer the budget, that's always is the biggest issue. And then my second answer is the issue we don't know about. And this year, that issue that we didn't know about, which we knew about, but we didn't know what the solution of the problem was Fatima Hospital and Roger Williams. They were on the verge of closing. And when I think of that, I think specifically of Fatima and all of their behavior treatment programs and beds. And what would that do to our system? You talk about wait times, you talk about getting necessary care. We crafted a very unique solution to keep those hospitals open. Realistically, we didn't spend any money, but we pledged $18 million in our rainy-day fund to help close that transaction to keep those two hospitals open and give them a chance to stand on their own fiscal feet. Whether they do or not, I don't know. That answer down the road, but I wasn't going to be the speaker that closed those hospitals. It was not happening on my watch. It is too important, it's too valuable to the healthcare system. And what would that do to the other healthcare systems around? What would it do to Rhode Island Hospital Emergency Room? What would it do to Butler Hospital if those beds closed? And it was working together with the Senate and the governor's office, and I'm proud to say we all checked our ego at the door. We sat in this room, several negotiations with bondholders, with buyers, with everybody involved to make it happen, to make it a reality. And that's what government should do. And with your help and your continued advocacy, the future looks bright for healthcare, and mental health care, particularly in Rhode Island. Thank you very much. It's been a pleasure and honor.
Good afternoon. My name is Trustee Calderon, and today I want to talk about something very, very, very personal to me: recovery from substance use and mental illness. One thing I wish most people understood is that addiction and mental illness are not signs of weakness, bad character, or failure. They are real health conditions that affect real people, families, and communities every single day. For a long time, society has pushed the stereotype that people struggling with addiction are lazy, dangerous, or simply don't care about their lives. People with mental illness are often labeled as crazy or unstable. Those stereotypes create shame, and shame keeps people silent. It keeps people from asking for help because they are afraid of being judged. I know this because I lived it, I breathed it, and I'm still breathing it to this day. There was a time in my life when I felt lost. I struggled not only with substance use, but also with mental health. Some days it felt impossible just to get through the day. What people didn't always see was the pain underneath everything, the anxiety, the panic attacks, the emotional battles, and the feeling that I wasn't good enough. Addiction was not about wanting to destroy my life. A lot of the time it was about trying to escape the pain I didn't know how to handle. But recovery changed my life. Recovery taught me that healing is possible. It taught me that asking for help is not a weakness. It is strength. It's called being a warrior. Recovery is not something you do alone. My family supported me throughout my journey, even during the hardest moments, and that support made a huge difference in my life. It has not been easy getting to where I am now. There were setbacks, challenges, and moments where I doubted myself every single day. But every day I kept trying, and that's all that matters, that I continue to try. Another stereotype I want to challenge is the idea that people with addiction or mental illness can't recover or be successful. That is simply not true. People in recovery are parents, workers, students, leaders, and advocates. We are people rebuilding our lives every single day. Recovery is possible when people are met with compassion, support, and understanding instead of judgment. What I want people to understand most is this: no one chooses to suffer. No one wakes up hoping to struggle with addiction or mental illness. But people choose recovery when they are given hope, resources, and support. Sometimes the smallest act of kindness, listening without judging, and encouraging someone to get help, or simply treating them with dignity can change a person's life. Today I stand before you not as my past, but as proof that recovery is real. Mental illness and addiction does not define a person, and it never defined me. Our strength, resilience, and ability to keep going to do so. Thank you. It is an honor for me to present Legislator Year Award presented to Senator Linda. I'm sorry, I apologize. Access to services saved my life. Our second legislator of the year, Senator Linda has been a steadfast and compassionate advocate for expanding access to behavioral health care. We are honored to recognize a public servant whose leadership is grounded in compassion, integrity, and an unwavering commitment to improving the lives of Rhode Islanders. Senator Linda was elected to Rhode Island Senate in 2022 to represent District 11, Brooklyn, and Bristol. She has distinguished herself as a thoughtful, courageous, and deeply principled leader to consistently bring humanity and a strong sense of justice in public policy. Whether she is served on the Portsmouth Town Council, where she demonstrated the kind of visionary leadership that brings communities together and creates lasting change. She proposed an innovative idea to develop affordable senior housing alongside the new senior center. She laid the foundation of what eventually became the Out-of-Benton House, which provides affordable homes for older adults. In recognition of this work and her continued advocacy for affordable housing, the Senator received the Housing Network of Rhode's 2025 Housing Innovation Award. For those of us in mental health and behavioral health advocacy community, Senator Ichifusa has been an extraordinary partner and champion. She has worked tirelessly to strengthen mental health protections and improve access to behavioral health care services, recognizing that mental health care is health care and that Rhode Island deserves timely, affordable, and compassionate treatment. Senator Ichifusa has shown tremendous leadership in addressing insurance barriers that too often prevent individuals and families from receiving the care they need. She has championed legislation promoting fair standards of care, accountability within the healthcare system, and stronger protections for patients navigating mental health and substance use treatment. But what makes Senator Ichifusa truly exceptional is that not only her legislative accomplishment, it is also the way she approaches this work. She listens to deeply. She values lived experience. She treats people with dignity and respect. She never loses sight of the human beings behind policies and statistics. At a time when many people feel disconnected from government, Senator Ichifusa reminds us what public service can and should look like: compassionate, collaborative, and deeply rooted in community. Senator Ichifusa, thank you for your leadership, your partnership, your steadfast commitment to creating a healthier, more just, and more compassionate Rhode Island. It is truly my honor and privilege to present to you the Legislator of the Year Award.
Thank you so much, and I have to say, estudié español por 4 años en mi escuela secundaria, pero se me olvidó todo. There you go. Thank you so much for joining us today. I want to start out by recognizing some of my colleagues that are here. Senator DeMario, Senator Raptakis was here, Senator, I'm not seeing, if I'm missing you, let me know, but of course, Senate President Val Lawson, the Chair of the Health and Human Services Committee, MHARI. We have so many champions of mental health care in Rhode Island, and I feel privileged to serve with them. And of course, all my house pals who are here. Thank you. Lori Marie, I have to thank you, the staff, the board, the volunteers, the partners of the MHARI Coalition. It's such an honor because I feel I am the one who should be thanking all of you, because the true unsung heroes of behavioral health care are the providers who show up every single day to help navigate what has become one of the worst healthcare crises of our time: skyrocketing demand for behavioral health care and shrinking access to affordable treatment. Every day, the people who provide that care are asked to do more with less. More, despite health insurance corporations imposing utilization management, meaning prior authorizations and step therapy. More, despite private equity firms treating providers like businesses to be mined for quick and high returns on investment, draining resources that should go towards patient care. And more, despite H.R. 1, what some are calling the big ugly bill, for cutting funding for essential services in order to pay for tax cuts for the wealthy. I've been working to pass legislation to push back against against some of these forces, but as mental health care providers and advocates, you understand better than anyone. There is no magic wand. Getting people, including policy leaders, to think and act differently takes a combination of complex strategies. It requires working across political, economic, and racial divides. So let me wrap this up with some personal history. It is not about my personal struggles with mental health, and I have to tell you honestly, my children who listened to this speech said, "Mom, are you sure?" And I'm going here. At the beginning of World War II, the government forced 100,000 immigrants of Japanese ancestry into internment camps. And that included my mom's family, right? Lawsuits were brought. Religious groups offered aid. Many Japanese American soldiers fought for America on foreign soils, including my dad and uncle. I analogize this to your battle with the kind of treatment you are receiving right now under the existing system. And during that time, were they making visible progress? I'm afraid they were not. And in fact, advocates had to keep pushing, including my cousin, for politicians to act to create justice. And finally, there is a happy story ending to this. In 1980, a Republican president signed a bill to pay reparations to Japanese interns. So I think that this is a model for how we have to keep working going forward. We are up against enormous sources, not only government, but more importantly, the money that is funding the kind of restraints that are imposed on you, the administrative burdens, everything, every single day. I'll give my last pitch, which is that every other industrialized country in the world has some kind of single-payer system, and that's what we should have. They pay 1/2 per capita what we pay, and they have better healthcare outcomes. And we are already paying enough to have that in America, and it is frankly lack of political will that makes this a situation. So history teaches us we can move through dark times, and these are very dark times. But by working together, I believe we will move through them again. So I'm honored to work with you, and I look forward to continuing the fight. Thank you.
Many of us were taught to stay strong, remain silent. Our struggles fight. For a long time, I believed that asking for help was a sign of weakness. I tried to push through anxiety, emotional pain, and the pressure to always appear okay on the outside when I was struggling deep within. One of the biggest barriers I face, I think we all do, is stigma. Not only from others, but with myself. I worry about others, judging, understanding, disappointing the people I care about. But my healing journey truly begins when I realized that recovery did not happen in silence. Healing happened through connection, support, and allowing yourself to be seen. What helped me most on my journey was finding safe spaces, supporting people, and learning that my voice mattered. Peer support, community, honest conversation remind me that we're never alone. I found strength in my children, my culture, my purpose to serve others. Recovery is not a straight path. I think I said this to all my coaches all day. Recovery is ugly, uncomfortable, messy, but when you have the support. There are good days, difficult days, setbacks.
victories, but every step forward matters. Today, I stand before you not because my journey has been perfect, but because I kept going, I choose not to give up on myself. To anyone who may be struggling right now, please know this, your story matters. Your feelings are valid, and asking for help is an act of courage, not weakness. Healing and recovery looks different for everyone, and there's no shame. And take it to time. You need to grow, recover, and discover yourself. By sharing our stories, we reduce stigma, inspire hope, and remind one another that recovery is possible. You are not alone, and there is strength in reaching out. Make a lasting difference in my life. Our lasting awardee, Karen Jackson, is one of those remarkable people you will never forget. Karen has dedicated her life to advancing social, racial justice, leading with compassion, courage, and unwavering commitment to the community. Throughout her career, she has used her talents in organizing, advocacy, public policy, and communication to advance issues including hunger, homelessness, housing, healthcare, welfare rights, domestic violence, and mental health. During her 10 years at Rhode Island Coalition Against Domestic Violence, Karen helped elevate public understanding of the intersect between domestic violence and mental health. She understood the savior of abuse often experience profound emotions, trauma, anxiety, depression, suicide thoughts. And that affects crisis service most respond with sensitivity, compassion, and dignity. Through her leadership, survivors were seen, heard, and supported. During COVID-19 pandemic, a time of heightened isolation, fear, and vulnerability for so many survivors, Karen secures resources to launch a powerful public awareness campaign, highlighting the connection between abuse and mental health. Through television, radio, public service announcement, social media, and community partnership, the campaign envelope. Saving life, mental health resources, and center to address the experience of Karen Armin served for 9 years as the Associate Director of Rhode Island Coalition for the Homeless, where she leads legislation policy and advocacy effort aiming at ending homelessness in Rhode Island. Most recently, Karen served as Director of Communication and Community Partnership of Horizon Healthcare Partners. She was also an early passionate advocate for 9/11, the important of building compassion, accessible crisis response system rooted in dignity, and human connection. Karen helped build a broad statewide coalition supporting 9/11 advocacy, or a coalition that continues to make an impact even after she retired. Beyond her many accomplishments, Karen was artistic, integrity, courage, and joy. She wears her value openly and unapologetically, reminding all of us that value-driven leadership truly looks like. It is with deep gratitude and admiration that we recognize your extraordinary leadership, advocacy, and partnership in advancing mental health awareness, crisis response, and support of survivors of domestic violence in Rhode Island. Karen, I'm truly delightful to present you with the Mental Health Hero of the Year. Congratulations.
that I had been arrested in Massachusetts for protesting cuts. She paused and she said, "They pay you to do that?" And I said, "Yes, they do. But to be honest, I would do it for free." So, it's been also fortunate to work at amazing organizations here in Rhode and Massachusetts, with amazing staff, great colleagues, many of you here, and all that joy has just been that we've had success. We've seen victories with bills, and civil rights, and prevention, and I think all those victories instilled in me this belief and optimism that does make a difference. Together, we can win great things for our communities, for the folks that we love, for other Rhode Islanders, which makes what's going on in Washington right now depressing, right? Sad. Put whatever word you want to put in. It's depressing, it's sad. The Trump administration is going after those we care about, and it's hard to watch, right? It's hard to watch it. And this is why our advocacy is more important now than ever. When it seems like a time that we should just sit and cry is when we really need to fight more, right? And I just want to end with a quick story that was just happened in the last 2 weeks. It wasn't like 20 years ago when you guys are like, yeah, no, this was just 2 weeks ago when I was up with the AFSB, the American Foundation for Suicide Prevention. We visited Representative Amo. We were lucky in our state, right? We go visit our reps and senators, and we're sponsoring the bill, of course, we support you. So, we're very fortunate. We're very honored to have amazing representatives and senators that we have. But we were there, and someone from SAMHSA spoke at the day before we went to go talk to everybody. Now, as most folks here know, SAMHSA is our federal, right, suicide, mental health, and substance use. They work for the Trump administration, but there are a lot of good people there that have been left. And do you guys remember, Laurie, you remember, because we were panicked in the fall when word came down that there were going to be massive cuts in SAMHSA. Right? We were like panicking because they were pretty much going to try to gut. And they didn't. And this SAMHSA administrator, and he said, now, you didn't hear this from me, but he said the only reason these cuts did not happen was because of you all. He said, NAMI, MHARI, AFSFP. He said every single district, red, purple, blue, got inundated with calls. And you did. Of course, you supported us. He said every single district was inundated with calls saying, you cannot cut this. He said it was the only reason that it got reversed and got reinstated. And so, it's because of us, right? Our advocacy is more important now than ever. We have to keep fighting, keep calling our legislators, even though they support us, but they still need to say to their colleagues, I'm getting a lot of calls, right? We have to vote, protest, do whatever we need to do to let our voice be heard. Because at the end of the day, right, this is what we used to say at the Coalition of the Homeless, as long as we are breathing, we are fighting, right? As long as we have breath in our body, we are going to fight. So thank you, and keep fighting. And Margaret, the talk to you about don't leave here without seeing. I saw my senator, MHARI. Did she leave? We're going to track her down there. Because don't leave today without saying hi to your representatives and senators. MHARI has a great package of bills that they want to pass. So as long as we're breathing, we're blessed. Yes.
Congratulations again to Speaker Shikarchi, Senator Rhode, Rousseau, and Karen Jeffries. said, thanks, but if I'm fighting, I'm going to fight in the open. And that's been our motto for more than 10 years. Today, you all have an opportunity to fight in the open. We're hoping that you will, when you leave this room, go over to our friends at Horizon Healthcare Partners. They have a table, and they can help you find your rep, your state rep, and your state senator. And they have maps, and they can help you get to the desk of your representative. And we're asking